Good morning. My name is Dr. Godel, and this case that I'm going to present is a patient with pericarditis. So, just a background according to the recent CDC data, around 177 million people in the US have now received at least one dose of the COVID vaccine, and out of them, there have been 762 reported cases of vaccine induced myocarditis and pericarditis. Usually, the common causes of such issues is infections, malignancy, autoimmune etiologies. However, with more and more people getting the vaccine, physicians need to be mindful of this emerging cause, and they need guidance if any adverse side effects do occur after these vaccinations. So this is a case of a 60-year-old male who presented with chest pain. He had a history of coronary artery disease and had cabbage done in the past. The pain that he presented with to the cardiology clinic started about 5 days after receiving the Moderna mRNA vaccine. The pain was pericarditic in nature. He would get worse when he would take in deep breaths. It would improve with ibuprofen. He presented to the cardiology clinic and some blood work was ordered. His CRP and ESR came back elevated. An echocardiogram was ordered which showed a small pericardial effusion and nothing else. The patient was prescribed some colchicine and NSAIDs and sent home. He came back a few weeks later. Symptoms were improved from before but were still there. Just to confirm the diagnosis, a cardiac MRI was ordered, and here you can see in the picture, you can see some edema and this late gadolinium enhancement in the pericardium consistent with pericarditis. The patient did not have a history of malignancy, no autoimmune conditions, did not have any recent viral infections, so a diagnosis of vaccine-induced pericarditis was made. So, a majority of the cases that have been reported to the CDC occur in younger individuals and after the second dose of the mRNA vaccine. Our patient was 60 years old and his symptoms happened after the first dose. Now, it becomes challenging for physicians because when he came in due to these complications, he was very hesitant to receiving the second dose of the vaccine. We talked to our infectious disease colleagues and our other cardiologists, and nobody seemed to have a good answer to whether it was safe for him to get the second dose or if he would develop recurrent pericarditis or myocarditis after it. However, we did recommend him to get the second dose, and he got the second dose. After that, he did not develop any recurrent symptoms, and he was sent home on a prolonged colchicine and NSAID taper, and now he is doing pretty well. So, you know, developing pericarditis after receiving the vaccine, especially after the first dose, is very rare. Um, However, the risk, the benefit ratio of receiving the vaccine is still, the benefit of it is still pretty favorable, and we are still recommending our patients to receiving the second dose. Thank you.